Good day, everyone. My name is Dr. Ogechi Eze, also known as the Soprano Doctor. I want to welcome us to my channel today as I discuss colon cancer, also known in common parlance as bowel cancer. So the month of April is Bowel Cancer Awareness Month. So today I will be discussing where exactly the colon is. I'll be discussing what colon or colorectal or bowel cancer is, the common symptoms that patients present with. I will discuss the risk factors. I'd also mention the screening options that are available, and then the management options and the things that we need to do. This is a health awareness video to empower us with tips to protect our health. So, what is colorectal cancer? It is a cancer that involves the large part of the bowel. For those of us that are in the medical field, those of us who have done biology or human anatomy, when we eat, food goes into the mouth, into the gullet or the esophagus, and then it goes down from the esophagus into the stomach. Okay, from the stomach it goes into the small intestine, which is usually central, and then you have the large bowel. It starts like the ascending colon, then you have the one that goes across, which we call the transverse, and then the one that descends, the descending colon, and then you have the sigmoid colon, and then you have the rectum, you have the rectum, and then you have the anus. So it's the cancer that is usually involved in the large and the lowermost part of the large intestine. Okay, so it usually starts like a small growth, and then it begins to involve the lining of the colon and the rectum, and there are different types, but that is more technical. So, what are some of the causes of colorectal cancer? So, I will be referring to my notes which I have made, and also I am using the patient.co.uk information leaflet which we distribute to our patients. So, the causes are unclear, but there are several risk factors, and those are the factors we need to be aware of. So, some of the common risk factors include age. Bowel cancer is more common in patients who are usually older than 60. So we say 8 out of 10 patients above 60 are at risk of developing bowel cancer. And then family history. So if there's a first degree relation who has had bowel cancer, then that is a risk factor and we should be aware of it. So for patients who have had conditions like having multiple polyps. So polyps are fleshy growths in the large bowel. This is also a risk factor. And then there has also been a link that has been found between ulcerative colitis or Crohn's disease, especially if it has lasted for more than 8 to 10 years. Obesity is also a risk factor. And then there are lifestyle factors that can increase the risk of having bowel cancer, and these include little or no exercise, drinking excessive amounts of alcohol, okay, and then taking little or no fruit and fiber. So we've talked about the risk factors. Now talking about the symptoms. What are the symptoms? These include passing fresh blood in stool. Sometimes it is blood that is mixed up with stool, okay? Or one could notice that the stool now has a dark color compared to what it used to be before. And most times it is painless. So painless bleeding from the rectum, or passing blood in stool, usually mixed with the stool, being painless. The other thing, people could also complain about this sensation of incomplete emptying, going to the toilet, you finish passing or stool, and it feels like there's something there, one still wants to go back. One can also notice new passing of mucus with the stool. That is also a symptom that we should be aware of. And then one can also start having like discomfort or crampy pain, sometimes the feeling of being full too quickly. Okay, so the other symptoms can present as the tumor grows bigger, and these some of these symptoms could be feeling generally unwell, feeling tired, losing weight. Sometimes patients can start having severe pain if this tumor has grown through and has been able to erode through the walls of the large bowel. Okay, so what are some of the assessments that are offered? So when I mean assessments, I also mean the types of screening. So sometimes your doctor can tell you to bring in a stool sample. This is sent off to the lab to check for blood in stool. A fancy name for the term is fecal occult blood test. And when we mean fecal occult, is that you don't see it really. So when you send the sample, it's sent off to the lab, and with specialized testing, they check for blood in stool. The other testing that can be done is when your GP, your family doctor, refers you, and then you have a camera. So it's a long, soft, flexible camera that's passed in through the large bowel to check for any growths, any erosions on the walls of the large bowel. There could be other more specialized testing like flexible sigmoidoscopy. So that is looking for any growth in the sigmoid colon, doing CT colonographies. This includes trying to have more precise examination of the large bowel. Now, you could also undergo a test whereby a little sample of the growth is taken, and that is sent off to the lab for histology. That is to look at it clearly to find out what type of growth it is. The treatment for colorectal cancer, if this is detected, is surgery. Now, the bottom line with colorectal cancer is knowing what the risk factors are, which I've mentioned, and then also knowing what the symptoms are. So, if at any point in time one starts noticing blood mixed with stool, or new mucus with stool, or a sensation of incomplete emptying, or a new change in your bowel habits. Let's say previously one used to go every day, and then you start noticing you're going like 3 times a day, or there's just been an alternative, an alternation in your bowels. Maybe today it's loose and then tomorrow it's hard, and it's just all over the place. Please try and see your doctor, who will do the necessary assessments, blood tests, and all the investigations that are necessary. If you've got any questions, please do not fail to ask them in the description box, and we will discuss further. Thank you very much.